Now is the time when you could tell us more about the equipment that is here in the studio and the purpose of the equipment. This is the 800 nanometer diode laser, which may appear to be just like the others, but this 800 nanometer wavelength is unique in that it affects the vein, but not the surrounding tissue. That means that we can use very thin laser fibers to close the veins directly under the skin without worrying about the possibility of skin deformations, burns, and so on. When the laser fiber is outside of the vein, it does nothing. It does not affect fatty tissues, and that means that we achieve a very good cosmetic effect. We can use this method to replace sclerotherapy. The most technologically complete and unique method involves this multi-scanner head which, as you can see, has a rotating laser beam. The idea is that the beam affects a single location. Of course, it is very hot and creates a lot of pain, but in this case, the laser beam is constantly rotated and we ensure that its effect is very brief, though at that moment it is able to leave behind its energy. There are two issues here. If we are talking about phlebology, then we know that the most difficult vein-related pathologies occur for patients with vein ulcers that do not heal, are infected, have necrosis, and are dirty. We color these ulcers with a special paint which includes this laser beam, and when they are irradiated, the tissues are purified, the infection is liquidated, and the problem is fixed in terms of the ulcer being healed. Of course, this apparatus has several programs which are meant specifically to clean tissues and then to close them up. This laser also has the unique ability of being used in dermatology so as to restore skin tone. The doctor talked about its effect on ulcers, but we can use it in the same way with greater force so as to be more effective in terms of affecting the flexible structures of the skin. When we warm them up, they increase in number to create firmer and tauter skin. In aesthetic terms, we can use the laser to close up blood veins that are aesthetically problematic on a patient's legs. We can close these expanded blood vein webs through the skin, eliminate pigmentation that occurs after sclerotherapy, and deal with long-lasting infections with different treatment methods. These lasers are available to us, and that means that we can deal with these vein problems from the beginning to a beautiful and aesthetically pleasing result. Because an operation is not always needed, problems such as capillary webs or the closing of tiny blood veins on the legs and the face are addressed with various methods, such as state-of-the-art radiofrequency or laser technology methods. This is the latest F-Care system radiofrequency vein treatment machine. It has 3 different diameters of electrodes, which means that we can close down not just large trunk veins, but also smaller branched veins during an operation, thus making it unnecessary to remove the branches. Today, I will demonstrate the closing of the smallest capillary veins in a way which can be used instead of a laser. There is a tiny golden needle which is just a few tenths of a millimeter in thickness. Using every 2 millimeters, we touch the vein and use thermocoagulation to close it up. Another method to deal with tiny veins or capillary problems is the latest generation Euphoton laser method, which involves a very broad range of functions. Our clinic has a wide range of lasers that we can use, and we can choose them to liquidate expanded blood veins in the skin. All of these lasers are transcutaneous lasers, and today we will be using the Euphoton laser. One of its functions is closing expanded veins on the legs, but this can equally be done on the patient's face. We can choose regimes which allow us to treat veins at various depths and in various locations. The beam enters the vein and is absorbed in its red structures. This creates a high temperature in the vein and more or less glues it shut. Sometimes pigmentation can appear after long-lasting infections or treatment of leg veins. A very good way to get rid of pigmentation is to use the Q-switch ruby laser, which divides up the pigment in the skin, then allowing skin cells to deal with the pigment by pushing it out through the lymphatic system. A small scab will appear after the procedure, and at first it may seem darker than the original pigment. Once it is peeled off, however, the pigmentation disappears.